All right, how you guys doing? It's Isaac Wade. Today we're going to be talking about treatments for acne. So, in my opinion, there are essentially two different ways you can really mess up your skin. The first way is by exposing your skin to sunlight over time. We know that photo damage accounts for about 80 to 90% of visible aging. And the second way is by having untreated acne. So I'm talking specifically about large acne lesions here, like cysts and nodules. And with these lesions, with each one, there's a chance that it turns into a permanent acne scar. There are treatments for these acne scars, but like I've said before, prevention is the best form of treatment. And it's best to just prevent these acne scars from occurring by treating acne before the fact. So today, I'm just going to talk to you guys about my experience with evidence based treatments for acne, what's kind of worked for me, what's kind of worked for people that I know. And of course, all of these treatments are treatments that actually work. Before we get started, just a couple misconceptions I want to quickly address. First misconception is that acne is caused by lifestyle factors like diet, like exercise, like those types of things. And while certainly lifestyle can contribute to acne, for the vast majority of people with really bad acne, it's almost all caused by genetics, right? For example, for myself, I naturally have very oily skin, and we know based on how acne occurs that people with oily skin are just much more likely to have acne develop. The second misconception I want to quickly address is that certain natural health products and supplements are effective for treating acne. And you see this a lot, especially in the era of social media. All of these super good looking, beautiful, charismatic influencers advertising these useless snake oil products. So, when it comes to medical treatments, like if you have a heart attack and you go to the hospital, the doctor is going to give you a drug that's supported by clinical evidence. A lot of these products that these influencers are promoting are not supported by clinical data, and therefore we really don't know if they work and whether or not they're even safe to use. So, for that reason, it's really important not to fall into this trap of trusting influencers, and it's important to talk to an actual healthcare provider about different treatments that have actually been demonstrated to be safe and effective clinically. So, like I said before, I'm just going to be focusing mostly on my personal experiences today, what's worked for me, what types of treatments I currently use. I'm not going to go super in depth on the scientific side and the mechanism of action side. We're just going to be talking about my personal experiences today. Back in the day in high school, I used a product called benzoyl peroxide. This is a type of gel that you can get over the counter, and I would just apply it once a night at bedtime. And benzoyl peroxide is actually really good. For an over the counter treatment, it's very safe, it's very effective. It doesn't start working right away. So, like with other acne treatments, it usually takes a couple weeks to kick in, but benzoyl peroxide is pretty good. The only downside I would say with benzoyl peroxide is that one, it can irritate your skin, so it might be something that you need to ease your way into. And two, it really does stain clothing this nasty yellow color. So you're going to want to be careful if you have any clothing that you really care about. So the second treatment that I tried when I was younger was something called salicylic acid. This is more of a wash, and this is also an evidence-based treatment. I personally didn't find salicylic acid helped much for my acne, but I do know a lot of people that benefit from using salicylic acid. It's also over the counter, don't need a prescription for that. So the next treatment that I tried when I was younger, and this was actually for a coverage reason. I was kind of just tired of paying out of pocket for benzoyl peroxide, and I wanted to use a treatment that was covered by my parents' insurance plan. And this product is called Benzaclin. So it's a mixture of benzoyl peroxide and clindamycin, which is a type of antibiotic. Benzaclin, I did find, was about as effective as benzoyl peroxide for me, maybe a little bit more effective, but not a whole lot more effective than benzoyl peroxide by itself. So after using Benzaclin, I switched to a more expensive and I would say premium treatment for acne. It was called Tactu Pump, and then I went to Tactu Pump Forte. So what Tactu Pump is it's a mix of benzoyl peroxide with a retinoid type of ingredient called adapalene. Retinoids, I'm not going to go too far into them. They have a very complex mechanism of action, but essentially they don't only help with acne, but they also have certain anti-aging properties. And this has been demonstrated mostly with the retinoid tretinoin, but I personally believe that this is probably a class effect, and that something like adapalene or like retinol will have some of the same beneficial anti-aging properties as tretinoin. Tactupump Forte, like I said, it uses adapalene with benzoyl peroxide. I really like adapalene. The only problem is that adapalene is very, very expensive. Okay, so Tactupump Forte in Canada, it's about $250. I would imagine it's probably even more expensive in the States. But I personally really liked Tactupump Forte when it was fully covered by my insurance. I'm not really covered under my parents' insurance anymore, so I don't use Tactupump Forte anymore. But at the time, it was a really great treatment, and I'm not super old or anything, so I didn't really have any tangible anti-aging benefits from the adapalene. But even if the adapalene was able to slow down aging by just a little bit, I would be very happy with that. But there is a period where Tactupump Forte I found was not effective by itself. So I actually talked to my doctor and we added on doxycycline, which is an oral antibiotic. So acne is caused by a type of bacteria called C. acnes, and oral antibiotics just help to kill off that bacteria. I think they also have some anti-inflammatory properties, but they're kind of like a later line treatment because anything you take orally is going to go systemic. It's going to travel all over your body, all over your bloodstream. And, based on what we're figuring out about the gut microbiota and the importance of some helpful bacteria in your body, might not be a good idea to nuke all of those bacteria if you don't have to. In my case, I was having some cystic acne. I did really, really, really want to prevent the development of permanent acne scarring. And for that reason, I did do a 3-month course of doxycycline. Doxycycline, I found it was fairly effective when added on to Tactupump Forte. Didn't do any miracles for me, but I did get clear skin about 1 month into the treatment. The problem I had with doxycycline had to do with side effects, and I admit this is probably partially my fault, but I was taking doxycycline one night and I didn't stay upright. So with doxycycline, the drug is very acidic, so it can actually really hurt your esophagus if it gets lodged in there. And for that reason, when you're taking doxycycline, it's important to take it with a large glass of water and to stay upright for about, 30 minutes afterwards. Okay, so on this occasion, I didn't do that. I just took my doxycycline, I went right to sleep, and I woke up a couple hours later with this terrible pain in my esophagus. And what happened is that the doxycycline actually got lodged in there and it started burning a hole in my esophagus. At least that's what it felt like. And for the next couple weeks, I had really, really bad acid reflux, a lot of pain there. And although, it was my fault for not staying upright when I was taking the doxycycline, it definitely wasn't a good experience. And that combined with the fact that, we're always learning more about the gut microbiota, and it might not be a good idea to take antibiotics if you don't have to. And then also with the antibiotic resistance, like if I actually got some kind of infection, maybe the bacteria would be resistant to doxycycline. All of those factors kind of led me to want to discontinue doxycycline. So during this process, when I was trying different types of acne treatments, there's kind of this underlying problem that I continued to experience. And that was my skin was super oily. And it's always been really oily. And none of the treatments I was using really helped with the oil production. Everywhere I went, you'd kind of you could see a reflection on my forehead. And I think a lot of people can kind of relate to this. And none of these treatments really help that much with the oiliness. And so I decided to discontinue the doxycycline, and I was really not interested in putting myself at risk of having acne scarring. So I actually I talked to my dermatologist and I started a course of Accutane, also called oral isotretinoin. And what Accutane is, this is another oral medication. It goes systemic. The drug gets all over your body. But essentially, it actually addresses the root cause of acne, which is the oil production, and it really helps to decrease the oil production. And for a lot of people, they find that after doing 1 or 2 courses of Accutane, their oil, like the oiliness of their skin, just decreases permanently. So it's almost like a permanent fix for acne for a lot of individuals. So I kind of weighed the risks and benefits. Obviously, if you know anything about acne drugs, Accutane, it's probably the acne drug with the most side effects. But I did like a risk to benefit analysis with my dermatologist, and I decided that Accutane was the way to go. And ever since I started Accutane, my skin's been completely clear. It's been fantastic. I haven't really experienced any side effects from this drug aside from, just having very dry lips, dry mouth, dry eyes, so dryness is probably the main side effect I've been having. But fortunately, I haven't really been having a lot of side effects with this drug so far, and it's been very effective for myself. So, couple things I'll mention about Accutane. First thing, for guys, it's it's fine. It's not too bad for guys. For women, you got to use some kind of contraceptive or be abstinent while you're taking Accutane because it does cause really serious birth defects. It's no joke. In the States, you got to get I believe it's like pregnancy tests every single month. In Canada, it's a little bit more lax, but you're really going to want to use two forms of birth control at least, or stay abstinent. The other thing I'll mention about Accutane is that it's better absorbed on a full stomach, particularly meals that are high in fat. So if you can, it's always good to take Accutane after eating a large, high fat meal. That's going to help it get absorbed better. And then lastly, Accutane, like some other types of acne treatments, makes your skin more sensitive to the sun. I've talked about this before, but sun damage is the leading cause of visible skin aging. So you're really going to want to wear a hat and use sunscreen and just take extra precautions if you're going to be outside in the sun. All right, so that's all I have to say today about treatments for acne that I've used. This was a less scientific video. I just thought I would talk about my personal experience with acne drugs and kind of what I've used and what my own experience has been, since I feel like people can relate to that. Thank you guys for watching. I appreciate it very much. I hope this video has been helpful. If you suffer from acne, make sure you talk to your doctor about using one of these evidence-based treatments. Like I said before, adjusting your lifestyle, while it's certainly something that you can try, acne is really a race against time, in my opinion. Especially if you have really severe acne, you're going to want to treat it as soon as possible to reduce your chances of having permanent acne scarring, which is very, very difficult to remove. So thank you guys for watching. I'll see you in the next video. All right, quick plug before I finish the video. Got a new pharmacy opening up with a couple colleagues at 1703 Victoria Park Avenue in the Greater Toronto area. Our pharmacy is called Surrey Victoria Park Pharmacy. We're open Monday to Friday, 9 to 6:30, and Saturdays, 9 to 3 p.m. We're going to be opening up early September, most likely after September the 7th. And you can give us a call at 416-285-6608 at that time. This drugstore has a bunch of really great services. We do delivery, blister packaging, medication reviews, vaccinations, any kind of service you can think about, we do. We've got some of the best pharmacists in the city, including myself, Chris Wong, who's also a hospital pharmacist, and Walter Lum, who's also a diabetes expert. So visit us, like I said, 1703 Victoria Park Avenue in the Greater Toronto area. Alternatively, you can visit the main store at 1314 Victoria Park Avenue. That is also in the Greater Toronto area. And you can give our main store a call at 416-752-0888. That is 416-752-0888. This is our main store, Victoria Park Pharmacy, located at 1314 Victoria Park Avenue. Thank you guys for watching. I'll see you in the next video.